Welcome to Mission Evolution Radio Show with Gwilda Wiyaka, bringing together today's leading experts to uncover ever-deepening spiritual truths and the latest scientific developments in support of the evolution of humankind. For more information on Mission Evolution Radio with Gwilda Wiyaka, visit www.missionevolution.org. And now, here's the host of Mission Evolution, Miss Gwilda Wiyaka.
Hello. Whether you're new to the show or an old friend, I'm so glad you could join us. Mission Evolution is the place to find the latest knowledge from today's leading experts. This hour will explore the hidden devastation of brain injury. When thinking about a brain injury, we often imagine a person in a coma. But what about less extreme cases? Say you're in an automobile accident and taken to the emergency room for an exam and x-rays. They tell you nothing is cut or broken, ergo, you're fine. You may be sore for a couple days, but you can go home. So you go home. As time passes, you realize something is very wrong. You may experience wild mood swings or hot flashes. You can't remember a phone number long enough to enter it into your phone, if you could find your phone. People refer to conversations you don't remember having. You may seem normal in the morning, but by noon, your head just shuts down. What is going on? With us this hour to delve into the complex issue of head injury is Dr. Michel Rathbone. Dr. Rathbone obtained his medical degree from the University of Liverpool, a Ph.D. in Biochemistry from McMaster University, and the Fellowship of the Royal College of Physicians, Canada, with specialist certification in neurology. He's a professor in the Department of Medicine, Division of Neurology at McMaster University. Dr. Rathbone has an active neurological practice where he consults inpatient spinal cord injury, acquired brain injury, and runs acquired brain injury outpatient clinics. He teaches programs at McMaster in neuroscience, neurology, and neuropharmacology. His website, greenbankclinic.com. Dr. Rathbone, thanks so much for coming on the show.
Well, thank you very much for having me. It's a pleasure to be here.
Yeah, it's just a pleasure to have you on. And I know you're a busy man, so it's really wonderful that you're taking time to help us with this one. So just to start out with, how did you get interested in neurology and brain injury and all that sort of stuff?
It's a long story, but basically it started when I was a very young child. I was in a one-teacher school. My mother was the teacher, and we were also the library for the region. So library books came in and went out, and some of the library books starred a neurosurgeon who was doing things like transplanting brains and fixing people, and I thought, that's the sort of thing I would like to do. So since then, I've been interested in brain long before I knew what the brain really was.
Fantastic. So for us lay people, we have all heard terms like brain injury, closed head injury, and concussion. So that we're all on the same page, would you mind kind of letting us know what each of those is?
Well, a closed head injury means that the skull has been hit, but not broken, not opened. So that's closed. A concussion is a term which people have tried to define. I'm not sure whether the definitions, as we can talk about a little later, are very helpful because according to the American College of Rehabilitation Medicine, one has to have certain loss of consciousness associated with a concussion or a time where one is confused afterwards. Not confused as to, gee, who hit me, but who am I, what am I doing, etc. So a neurological confusion. And we don't see that in all patients who have symptoms of concussion. So that's a very important thing. Brain injury really means that the brain itself is injured. Now, it can be injured in many ways. It can be injured because of blood clot. It can be injured because of a bleed. It can be injured because of tearing the fibers in the brain. the nerve fibers, or it can be injured because there is inflammation within the brain, either in this case from the concussion itself. That's an inflammatory change produced in the brain. But also if you have flu or something like that, you'll realize that your brain is not working properly, and we feel terrible for a while. And that's an inflammatory change in the body and in the brain that stops the brain functioning normally.
Oh, so is that why we're getting the brain fog with COVID? They've come to call it COVID brain, is the inflammation piece?
Yes, absolutely. COVID is a wonderful example of a post-inflammatory brain syndrome. Uh, but there are many examples before that. I think we've all had flu or some other febrile illness where we get a fever long before that, and we felt terrible, and the brain just wasn't working. And now people who've had COVID, this is existing for a long time.
Unfortunately, yes.
Mhm.
So also the other question is, so a stroke would be considered a brain injury, is that correct?
Yes, it would be a form of acquired brain injury, because if you block the blood supply to the brain, or in a hemorrhagic stroke, if you cause a bleed in the brain, that damages brain tissue. And so there's brain damage, and that's a brain injury.
Okay, that makes sense.
But
So
it's a different, I must say, it's a focal brain injury, whereas a lot of the brain injuries that we deal with in concussion are more general. They affect more of the brain.
okay, so like the impact causes bruising or damage in a wider area of the brain rather than just a specific area.
That's correct. In fact, what happens usually, we see a lot of car accidents. People have their bodies thrown forwards, thrown backwards, and the brain then rocks inside the skull, because the brain has a small amount of fluid around it to protect it, and it floats in this. It goes backwards and forwards, and it's rather like the hemispheres are the top of a mushroom, and then the lower part of the brain is like the stem of the mushroom, and the junction of those gets a lot of tearing forces, shearing forces, so that this can interrupt all the functions that go on in that deep part.
So let me see if I've got this right. You're ending up with a closed head injury, what you're describing to me, because you haven't struck the head or the head hasn't been cracked open, but the rapid movement forward and backward is like jello in a jar kind of thing.
That's exactly what it is. Yes,
Okay, and so that means you're impacted in the front, you're impacted in the back, and then is there pressure or strain where the brain meets the spinal cord?
well, in fact, it's just above where the brain meets the spinal cord. It's the brain stem. So the stem of the brain is rather like the stalk of the mushroom, and a
Gotcha.
lot of the force is applied to that, as well as some damage to the front and back of the brain as it moves forwards and backwards and hits the skull.
Now, do the symptoms from this show up right away or do they show up over time?
Usually, well, there are two things. Number one, if you have a very severe brain injury, you're unconscious. So, a bad concussion, you'll be unconscious. You won't have any memory of the accident, because the memory function is part of that uh, brain injury. So, you cut that off for a while. But then you get better and you think you're fine often. However, after this, you find that you have a brain fog, and that becomes much more apparent when you try and do things. So that sometimes doesn't happen for days or weeks, because you may be resting and nothing else going on. But
So
in
it
addition,
strikes me, I'm sorry. It strikes me that then, ergo, a lot of those kind of head injuries can go undiagnosed. Is that accurate?
oh, absolutely, absolutely. I see patients who've got a head injury 3 years ago, and they were told, you're fine. But
Mhm.
then they come to me 3 years later and say,
And they've been
I'm not
struggling.
fine. Yeah.
Yeah. And doesn't this have some kind of a psychological impact on people when they don't know what's wrong, but they're just not the same?
This is absolutely true, not only on the patient, but also on the family. So I
Mm-hmm.
have family members come in and say, my husband or wife is just not the same person as before the injury.
Now, go ahead. I'm sorry.
I am sorry, I was going to say, and that they then explain in detail all the things that is different um, about the mountain.
So when you have just a typical forward and backward motion, so if you're facing slightly away when the impact happens, I would suspect it affects a different part of the brain. But if you're doing just the straight forward and back, so what does the front part of the brain, when it's injured, what are the symptoms?
Ah, these symptoms were first discovered many years ago by a man called, when a man called Phineas Gage, who was a railway worker, managed to get a metal spike through the front part of the brain and destroyed a lot of the front part of the brain, but still recovered. This is back in the 1800s, which was quite miraculous. He lived for many years afterwards, and he could do all his calculations and everything else. He was very high functioning before and after. But afterwards, he went from being a very sober member of society that everybody looked up to being a drunken layabout who could make plans but never carry them through. He had just no what psychologists call superego. He'd lost all his ability to shield what he was going to say and think about it before he said it.
So Tourette's comes to mind, right?
Yeah, exactly. But this is terrible. When you have frontal damage in the brain, it's a real problem because you don't have the judgment, you don't have the control over your emotions, over your feelings, and everything is very raw and exposed. And this, of course, makes you a very different person.
Mm. So this might be a little bit of a left turn, but is that where the lobotomy then came from that became so popular around that time?
Well, lobotomy, yes, that was to prevent depression. So that was a slightly different surgery. And of course now, thank God we've abandoned that.
Yeah, one of those great ideas that wasn't so great. Yes.
That's right.
Okay, so then how about, and we're about out of time in this segment, but how about the back part of the brain then, when you go back then? So you go forward, you go back. What happens when you injure the back part of your brain?
Back part of the brain we see very often in people who fall in the winter and they hit the back of the head. They often fall backwards. There's often a flash of visual change because the visual cortex is at the back of the brain. Rarely do we see blindness afterwards, but certainly the back part will give you that flash, and often, people who hit a hard object, the deceleration forces are very much more than if they hit a soft object, such as the back of a car seat. So they're pretty well affected, but also the brain will then bounce forwards as well. So people who hit the back of their head also will get a problem with the front of the head.
Okay, and so when you're in a whiplash situation, but you haven't literally struck the back of your head, except possibly on the seat, which part is affected more, the front or the back of the brain?
It's all affected. People usually don't get visual changes moving backwards, just simply backwards.
Gotcha.
But they do get a lot of problems when they move forwards. But again,
well, we're going to have to take that station break. Dr. Rathbone and I will return very shortly, so don't go away. This is Mission Evolution, www.missionevolution.org. Hello again. This is Mission Evolution, missionevolution.org. With us this hour discussing the hidden effects of concussions and other brain injuries is Dr. Michel Rathbone. His website, greenbankclinic.com. Dr. Rathbone, we were talking about the effects of closed head injury that we see in a car accident. What are some of the other real common head injuries that people get in this day and age that oftentimes go undiagnosed?
First of all, sports concussion. Often the concussions are what we call subconcussive. People don't lose consciousness, but the repeated acceleration forces on the brain are quite significant. So, for example, a soccer player may head a ball in practice many times a day, and they've been shown to have loss over time of certain areas of the brain. They shrink. A person who plays football and does a lot of training and using their head to butt is subjecting their head to a lot of acceleration, deceleration forces, and that may be done many times a day. So this is why we see problems if a person's played school football, college football, and then goes into a league such as the NFL. They are going to have a high chance of having some brain damage that is ongoing.
So let me get this straight. So it's the repeated injury then. So it might be a minor injury, but it's repeated and repeated and repeated.
Yes, the effect of a minor injury is very difficult to see, but if you do it many times, it becomes very obvious.
Interesting. So that would build up slowly over time, and the person would just be deteriorating at a rate that they may not notice at first?
That is correct.
Mm.
And we now know that the condition CTE is recognized with individuals who have repeatedly banged their heads. And these are mostly individuals who play hockey or American rules football, but also there are changes in soccer players, anyone who continues to bang their head.
So, boxing, say, for instance.
Oh, well, that's been known for many years. There's a condition known as dementia pugilistica, dementia of people who fight.
Wow. Just amazing. So how, again, for our audience, how can people tell if maybe they have a brain injury that's gone undiagnosed?
Well, first of all, it's nice to have a history of the brain injury, first of all. Then second, there's a number of ways we can look. MRIs usually, a standard MRI usually does not give you very much help because the brain looks okay most of the time. But functional MRI could help, and it's a very expensive way of looking at the brain. Single photon computed tomography is another way, SPECT scan of brain, that can show differences in blood flow to various parts of the brain. That may give some indication. And other than that, one can do certain testing. I use in my office a technique called Vox Neuro, in which we give a person certain tests, cognitive tests, and at the same time they're looking at a screen to see that. And at the same time we're recording brain waves, and at certain points after they've been given each problem, so we can see how well they're solving the problem, and we can look at the attention, concentration, information processing, and the working memory. And so we can come back and give them a readout, a percentile readout for the population of each of those.
So, do people sometimes show ADD symptoms once they've had a brain injury that involved the brainstem?
People show a number of symptoms, but usually the two that are very common are anxiety and depression.
Interesting. And that would be hard to trace for a person, wouldn't it?
Well, people can tell you whether or not they've been treated for anxiety or depression before the injury. And I use a rule of thumb and explain to patients that if you've had anxiety and depression before the head injury, it'll be almost certainly worse afterwards. If you haven't had it before, you will have it afterwards. And so those have to be treated. We treat the results of the concussion. We can't put the brain back together quite yet, but certainly we have to treat the symptoms.
And that brings me to the important question of how do you treat a head injury?
This will depend on the symptoms. Now, almost all head injuries that we see are associated also with neck injuries, whiplash injuries. So a lot of pain from the neck, and treating that is very, very helpful. We have a number of ways we treat that with some slow, very gentle stretching. This seems to work very well. Additionally, we use various creams. We have some creams that take the medications through the skin and release them right where you want them, on the muscles and nerves just below the skin. And so very little gets into the circulation compared to what gets into the area that you want to treat. So this is a very good way of doing this. And we can use various compounds in those creams, which would include something to dull pain over the surface of the skin, as well as muscle relaxants, as well as medications that can reduce nerve firing in that area.
So by using a topical application, you're impacting the body less with the drugs?
Yes. The idea is if something goes through the skin, the highest concentration has to be under where you've put the cream.
Pretty amazing. How long has that been available? I'd not heard of that.
Oh, it's been available for probably 10 years in various, the material that takes it through the skin is the important thing, and then the materials you put in it, the medications you put in it are variable, but both have been available, medications for a long time, but the whole compound only about 10 years.
I understand that you work with a combination between the head injury itself and the musculoskeletal stuff. Would you speak to that a little bit?
Yes, well, it's very, very important. It was discovered back in about 2008 by an Australian group led by Mears, that patients who had head injuries and patients who had injuries to elsewhere in the body without injuring their head had the same incidence of post-concussive symptoms. And the symptoms were the same.
Wow. What causes that?
Well, that was very interesting. And that started us off on a research project looking at this, because it sounded so weird. If you break a part of your body, well, why would the head be involved? Well, it turns out that the head is involved, it seems, from our research, because any inflammatory change in the body produces inflammatory proteins that go to brain, and there are certain inflammatory proteins particularly that are involved in this. And we've now got some very recent papers just published, some others in press, showing which of the inflammatory proteins affects which of the symptoms, such as mood changes and cognitive changes, etc. So this is how it works.
So have you followed up on how, say, dietary things can cause systemic inflammation and then impact the brain?
Yes, we have. It's very hard, though. We're hoping to set up exactly that test in our practice shortly. But it's very hard otherwise to get people to follow a dietary pattern that is not their usual one.
People are attached to their food comforts, aren't they?
Absolutely, absolutely.
Yes, yes. So, do you have any target things in food that you think or you suspect might be an issue?
Well, we know several things about food. We know, first of all, if you take in a lot of food and you get a lot of subcutaneous fat, that is inflammatory. So you're trying to get rid of that, but it's very difficult for people to try to lose weight. There are ways of helping people, but they're all pretty extreme. There are some diets that people can go on, and usually removing a lot of the carbohydrates helps, which has led to a number of diets. But it's important then to have enough balance in the diet. So you have to have sufficient green stuff. But some of the materials that are in the food potentially can be compressed and put into pills. So if you want to take the pills instead, that's fine. But meantime, things such as eating a lot of dark leafy greens are very good. These seem to have the right stuff.
So to kind of help with inflammation?
Yes.
Inflammation is a much larger problem than what we originally thought, isn't it?
It is, and it's very, very complex because there are so many components, cellular components, that one is drawing out on charts, 50, 60 components. And this is why just taking an aspirin isn't going to help after you've had an injury.
How can a person detect themselves, if they are having inflammation problems? So it gives them an idea. I've got something going on here. What shows up first?
It's difficult for a person to determine that on themselves unless they had blood work done to look for some of the inflammatory proteins, some of which are measured quite frequently, such as a protein called CRP, but others are not assayed very often. And some of the ones that are most important require very specialized assays.
So you can take the test to see if you have inflammation somewhere, but then it becomes a hunt situation. Try to hunt down where?
Well, yes, but often people come and they say, I have pain in my wherever, and that's the source. So sometimes it's not exactly rocket science to get to the basis of it. But don't tell anyone that because we like to keep the magic.
Keep the magic going. Keep the magic going. We're about out of time in this segment, but how long have we really recognized the impact of inflammation?
Probably about 10 years.
Pretty recently.
Discovered 2008, but about 10 years ago for concussion, it's become increasingly obvious, and everybody now accepts that.
Has COVID played a part in bringing this to the fore as well?
It's not as far as concussion is concerned, but everybody has looked to see the basis of long COVID, as we call it. Mm-hmm. And now people are recognizing that it is an inflammatory process.
And a big one too. It doesn't seem to
Yes,
go away.
that's right.
Yeah, yeah. Well, it is that magic moment. We're about to take another station break. When we get back, I'd like to get more into some of the natural things that you've started working with to help the brain. So, Dr. Rathbone and I will return right after this, little break, and for this fascinating discussion. You stay right there. This is Mission Evolution, www.missionevolution.org. Welcome back. This is Mission Evolution, missionevolution.org. This hour, our expert guest is Dr. Michel Rathbone. His website, greenbankclinic.com. Dr. Rathbone, we were about to talk about some of the natural supplements that you have been working with that might help with brain injury or inflammation. Would you mind going into that a little bit?
Yes, what our policy has been initially um, to see what we can find in nature, rather than just use what we have from the pharmaceutical companies. The pharmaceutical drugs are good, but there seem to be other ones around. There seem to be other molecules around in nature, millions, quite literally, that could have beneficial effects. And now a lot of work, in fact, funded by pharmaceutical companies, is looking at products that are seen. So we look at many products. Some of them are very well known, and we use products that would include, for example, green tea extract. Green tea extract has well been known to reduce inflammation and increase brain function. We know that, for example, ginseng has a long reputation of doing the same, and maca root doing the same. And in fact, we've developed coffee, which is also known to do exactly the same. Coffee is actually very good for you. And by mixing these together, one can take one's pills, but enjoy a cup of coffee at the same time. So one is actually not taking pills, but one is drinking coffee. It's a great way, we think, of giving the medications. But
And what's the name of your coffee?
Beautiful Mind coffee.
I love it. Now it's available in Canada on Amazon. When are you going to get it in the United States?
We are anticipating in the next 2 or 3 months being in the United States.
Fantastic. Well, I anxiously await it, I have to tell you. So, when did you decide that looking at some of the natural remedies versus just the pharmaceuticals would be a good direction to go? What prompted that?
It was prompted a number of years ago, about 12 years ago. I was working with another scientist, physician scientist, Dr. Chui Jiang from China, who we were working on little molecules. I discovered a number of years ago that some very small molecules in our body that are universal had important signaling properties. They caused outgrowth of nerve processes, and they caused nerves to have divided nerve processes depending on the concentration. So that was a very interesting finding, and we were working with Shui Jiang, who said, look, I've got some Chinese medicine here, Chinese herbal formulas. I'd like to try them. So we tried them, and yes, they worked. And of course, these are all natural products. So we went from there and we thought, well, must be other things that also help, that are sort of sitting around, that some people have used for years and some people have never heard of. So we then got into looking at various natural products, and we find that there are many natural products that are potentially very helpful. They reduce inflammation, and they help with the whole recovery of brain. So that's very important, and brain protective as well. And we were talking earlier about diets, and in fact the so-called Mediterranean diet, if you can keep the amount of various factors in the Mediterranean diet appropriate, then that is excellent. And we know that some of the oils, the olive oil particularly, is very helpful in small quantities. We know also that eating fatty fish, such as salmon and sardines and mackerel, those sort of fish, they're very, very helpful. The oils from them, if you take enough of the oil and the right sort of oil, the DHA instead of the EPA, those are also very helpful for brain function. So there are a whole number of those factors, but now there are also many factors that not only appear to help brain to recover, but even prevent brain from getting injured in the way that it does in aging. Aging is an inflammatory process as well, and people talk about inflammaging, and a group of scientists back in 20 years ago in Vancouver have suggested that Alzheimer's, for example, was an inflammatory disorder, and we know it isn't caused by inflammation itself. There are other factors going on. We know that it is associated with inflammatory change. So we believe that it's likely that people who can keep inflammation to a minimum will do very well with brain health by eating the right things, by staying away from the wrong things, and doing other simple things, not to do with diet, but to do with exercise. And they will have better brain health. And in fact, the American Neurological Association has got recently into the area of brain health, and we're now studying brain health as an issue, as opposed to rebuilding things, because sometimes one has a Humpty Dumpty problem. People do injure their brain. They've injured it enough that we can't do very much about it. But if you prevent Humpty Dumpty from falling off the wall in the first place, you're miles ahead.
So you said something that really perked my interest, in that all these fats you mentioned being very necessary and very helpful for brain health. At least in America, for a while, we went on this gig that fat was the enemy. Low fat this, low fat that. And by all means, let's replace it with something artificial. Did you see, or have you had any reports of that having impacted us in a negative way?
Oh, yes. We are aware that certain fats are not good to take in large quantities, the saturated fats. But we know that the trans fats that people have replaced butter with and made margarine are terrible. That they really have very nasty effects on the body, and they build up inflammation in the arteries and do exactly the reverse of what one would have thought they might otherwise do.
It's not nice to fool Mother Nature, right?
That's right. So we now know that butter is good. So it's become, as we've got more and more data, the information has flipped in the other direction. So there are good fats, certainly, which are the polyunsaturated fats that I just talked about, and those are good. A certain amount of straightforward butter, etc., is not bad for you. Carbohydrates, however, that were praised to the high heavens, we now realize are perhaps not that good. They put a lot of strain, for example, on the pancreas, because you eat some bread, and now you have to immediately push out blood sugar, and so the pancreas has to be triggered and worked. And so these peaks of blood sugar are not good. They're not good for the pancreas. They're not good for the body itself.
What about your refined carbs and refined sugars and all this, we take what nature gave us and then we have to get our nasty little hands on it and alter it. Are we finding that the more we change things, the worse they are for us?
Oh, there's no doubt about it. There's a lot of data in the literature showing that if you can stay away from highly processed foods, you're much better off.
Hmm. And I know this is a hot topic, but how about GMOs? Have you seen any evidence that that's a problem?
GMO, the problem there is if you have only got one specific change in a protein in a plant, that may not be bad, but the way many GMOs are produced necessarily produces several mutations, not just the one you want. And we can't do it with humans, and I don't think we can yet do it with plants. It's very difficult to actually just hit the one amino acid in a protein by altering the genes.
So then we're eating food that's altered from what was ideal for us.
That's correct. That's correct. And it's fairly straightforward to eat food that is good for you. For example, there's been a study in the northwest of the US in which people were shown to become younger over a period of 2 months by eating different foods. The foods they were eating included a lot of leafy dark greens and not so many potatoes. And there's a sort of a rule: if it grows below the ground or if it's white, stay away from it. White sugar and white flour, and so on. So these are some things that will increase fats. They will in the body, and they will be not good for you in large quantities, and certainly because they induce inflammation with the fat, will not be good for the brain, will not be good for brain recovery.
So the refined carbs produce fat and inflammation, and that's how they impact the brain. Is there any other way that they impact the brain?
Yes. For example, if you have a high carbohydrate meal, it's typical to feel very sleepy afterwards. And the reason for that is that you've pushed out a lot of insulin from the pancreas to try and get the level of the carbohydrate down, and then this overshoots. This tends to overshoot, and then you become very tired with this big up and down. And it's also not very good for in fact, it's bad for the blood vessels and other parts of the body that are very important.
So it can affect circulation, which of course would affect the brain if the circulation isn't as good, yes?
Absolutely. Even the microscopic vessels in the brain can be affected. And that is a very bad thing to happen.
Now, is the circulation of blood, is it different in the brain than it is in the rest of the body?
No, the brain takes a huge amount of the body's blood supply because it's so active and it's using a lot of oxygen, producing carbon dioxide. So there's a huge blood supply to the brain. It's a little different in that the arteries are largely end arteries, so that there are no sort of parallel supports. So if you block off an artery, everything downstream of that will tend to die.
Mhm.
And that's why strokes are very bad.
Well, it's that magic moment. We're going to have to take another station break. On the other side, I'd love to get into brain health and anti-aging. So Dr. Rathbone and I will look into that on the other side of this commercial break as I continue to explore the amazing human brain. This is Mission Evolution, www.missionevolution.org. Hi there. This is Mission Evolution, missionevolution.org. With us discussing healing brain injury is Dr. Michel Rathbone. His website, greenbankclinic.com. As promised, Dr. Rathbone, we're going to discuss anti-aging and neuroscience. So please.
Right. The brain itself is very, very important to aging. If you can keep the brain young, one tends to keep the body young. And to keep the brain young, one has to keep a good cardiovascular system, the heart, and everything else. Now, how can we do that? Well, it may not be as difficult, at least to get a lot of benefit as one might imagine. And the first thing we recommend is that people exercise, because we know that factors are released by muscles. And obviously, the bigger muscles release more factors than the little muscles. So we encourage people to walk and run and swim and do all the other things that require exercise of the arms and legs, as opposed to just the thumbs for texting. Now, you don't have to do too much. Probably the theories of 10,000 steps a day are really an overestimate. In fact, the recent research has shown that one can improve brain function by as little as 10 minutes a day of exercise 3 times a week. And it is likely that a very short period of exercise with some bursts of higher activity in it, say 3 20-second bursts in a 10-minute epoch, 3 times a week. We know that that improves cardiovascular health, and there's now studies that have been done showing that it's also improving brain health from factors released from the muscle in the circulation that go to brain that cause an increase in stem cells and also an increase in some of the brain hormones, such as brain-derived neurotrophic factor, and these cause an interaction between nerve cells to increase. So those are very good. And essentially, if you can do a couple of days of just gentle weightlifting, gentle strengthening, not just necessarily with weights, but strengthening exercises, and then 3 days a week of doing something else for 10 minutes, which is more aerobic, that's probably going to help your brain a huge amount.
So it sounds like it's something that you could do in the winter in your living room without any equipment. Instead
Yeah.
of just treading away on a treadmill, you could do something like yoga and intersperse it with jumping jacks, something that got your
Yes,
heart rate up. Is that kind of what we're looking at here?
absolutely.
Well, that's a good news, because I think a lot of people struggle with trying to get to the gym or trying to have equipment at home, and just using our own body weight as resistance. Can that help?
Absolutely. There's no doubt about that.
So again, it's back to the way that we were kind of designed.
That's right. We were designed to be active and run around. Now, that's number one. It's a simple way of helping our brain right off the bat. Then we go into the diet that will keep your brain young. And we've already talked about the diet, and particularly the green leaves are very, very important. There are factors in these leaves and in also the red and yellow plants that are very good for us. And so that diet is superb. Taking enough roughage alters the environment in our gut and improves the bacteria which colonize our gut that produce factors that again go to brain. So that's a circuit. So the diet is very, very important.
So let's talk just a little bit. This is such a fascinating topic, is how the gut really affects the brain, and yet we do a lot of things in modern day society that impact the gut in a negative way, like antibiotics or refined foods. How exactly does the gut impact the brain?
Well, that's a subject of a lot of research at the moment. There are several ways that are thought. First of all, the bacteria in the gut and the other microorganisms, when we feed them, they produce factors, and those factors can then be absorbed. So instead of giving a drug, the microbiota in fact produce the factors that go into the brain. So that's very good. Also, the nerves supply the gut, and they are connected. The vagus nerve is connected right up to the brain. And it is thought that the vagus nerve also plays a big role in brain function. In fact, there has been some suggestion that the gut may be one of the first organs damaged in Parkinson's disease, and that perhaps the Parkinson's disease then goes retrogradely up to the brain. So that's an interesting hypothesis, and it's being actively worked on. So those are some of the things that one can do, but also there are many, many other chemicals, and we're looking at these chemicals. Some of them produced in the body itself, but to raise their levels appear to be very important. Other things, such as the factors from blue and purple fruit, like blueberries and blackberries, are very, very good. These are anti-inflammatory, but they are also important factors in brain function. So using those is very, very important, as well as factors such as green tea extract is a very good factor. So by using a combination of these factors, and making sure you don't use factors that are going to fight each other, which would be possible, one can, we believe, reduce the aging of brain. And we're working on this very actively at the moment.
How does the aging of the brain impact the aging of the body? Which came first, the chicken or the egg?
Good point. There are a number of suggestions that the aging of the brain is probably very, very important. If the brain is aged, the brain controls a lot of the body's automatic functions through the autonomic nervous system. And if the brain ages and those don't work properly, then a lot of our body functions will be lost or will be deteriorated. However, the body also is very important in feeding back to the brain in that, for example, without getting too biochemical, there's an energy compound in all our cells called NAD+. And this level is very important. If we can keep that level high, then we have energy in our brain, in our bodies. If the level drops as we age, which it often does, then we sort of fade out. But if we can replace it, there's evidence that we do a lot better. However, inflammation turns on certain proteins, certain enzymes that in fact use up this NAD+. So that is, inflammation is in fact part of aging. So we've got the brain doing one set of things and the body doing the other. And if we adjust everything, they should work together very well, but otherwise they'll be fighting against each other.
I'm glad you also mentioned that sometimes things work together and sometimes don't. There's a lot of these startup companies that have this wonderful cure and they use this shotgun approach of herbs and supplements and throw it all together and, hey, take this. What do you have to say about those and what's our alternative?
Well, one has to first of all find what herbs work. Herbs do work, extract of herbs, but in any plant, there are thousands of these compounds, literally thousands of various different proteins, of various compounds, some of which are beneficial. So one has to work out what's beneficial, what's not, and then what one can combine them with. So it's not a matter of doing things willy-nilly. It's a matter of if you're using many compounds, you have to make sure that they aren't fighting each other. There have been some studies which show that a series of anti-inflammatory natural products reduces aging in mice and makes the health span much better. Now, health span is very important because we want to live a healthy life, not necessarily an infinitely long one, feeling very sick most of the time. So health span is good, and these mice treated with anti-inflammatory agents certainly lived a very healthy and long life. However, the thing is that to try to get those into a human and know that the humans, who are different from mice, are going to benefit from this is a very different kettle of fish, as you point out. And just throwing things together and, hey, take this mixture is not going to work.
That's kind of been my experience. So it is that time in the show when I need to ask you, Dr. Rathbone, what is your mission?
Well, my mission is to continue to improve brain health, particularly after brain injury and concussion. And I would like to also improve brain health for aging, which seems to be a very, very similar path. So we're looking at various ways of preventing brain aging, as well as causing recovery from various injuries and concussion.
So, what's your vision for the future of brain health? Where do you think we can get with this? Do you think we can actually be better than we have been for years?
We can certainly be better than we have been for years. Absolutely. The problem is that some of it, like exercise, requires people to do something. And most people, if you give them the alternative between exercising for 10 minutes or popping a pill when you clean your teeth first thing in the morning, they'll go for the pill. And we don't yet have an exercise pill. People are working on that, but we don't. And that's just one example.
But so then all the pills that you pop with all the supplements or drugs or whatever to help don't really mobilize well without the exercise, do they?
Exercise is going to be very important, yes.
Mm-hmm. So we are just about out of time, which is regrettable. But if you had one thing to tell a person where they could start this process of getting rid of inflammation so that we can have sharper brains and live longer, what would it be?
I think exercise would be the first thing, and then take a few appropriate things, and we've tried to put them in Beautiful Mind Coffee, and that's the sort of way we're going.
Well, it's just been absolutely wonderful spending time with you, and you've been such a wealth of information. We could go on, but unfortunately, we are out of time. Thank you so much, Dr. Rathbone, for coming on the show.
Thank you very much for having me.
It's been a real pleasure, sir. Our guest this hour has been Dr. Michel Rathbone. Dr. Rathbone teaches programs in neuroscience, neurology, and neuropharmacology, has an active neurological practice, and runs acquired brain injury outpatient clinics. His website, where you can get a hold of him and find out about his clinics and hopefully about his coffee, is greenbankclinic.com. This has been Mission Evolution with Gwilda Wiyaka. For more information or to enjoy past archived episodes, visit www.missionevolution.org. Please be sure to join us right here next time as this mission continues, bringing information, resources, and support to an evolving world.